we made the mistake as Republicans, at least some Republicans, by passing McCain-Feingold. It was Democrats and Republicans, but obviously some Republicans. McCain-Feingold makes it illegal within 60 days of the election for me to buy an ad on television saying, Ben Chandler voted for gun control, or Ben Chandler voted for this or that. That's illegal in our country, illegal. I have a taxpayer group. It's illegal for me to say my congressman voted to raise taxes 60 days before the election. That's the wrong approach to campaign finance reform, but I think there are ways we can say that we care about campaign finance reform and we can attract independents who want to reform government. So I would say that the things that face our country are very dire. The debt is the #1 problem that faces our country, and we are in dire circumstances and have to change. I would also say that there has to be some reform or you'll never see change. And the reforms, I think, have to be in the form of new rules. And these rules would limit terms for people in office. You could have 6 2-year terms in the House or 2 6-year terms in the Senate. But the terms need to be limited because they get up there and they lose their way, Republican or Democrat. Another way you can do reform is through the campaign finance reform that we talked about with federal contracts. But we have to do something because things are slipping away from us, and I think you're seeing that. You're seeing this movement within the Tea Party movement. You're seeing it across the country, and I think the time is now, and the time is right for an outsider, someone who is not part of the system, not part of the hierarchy, that is new blood and a fresh voice to come and represent us in Kentucky. Thank you very much for having me.
I'm going to ask you if anyone here has a question. We'll take about 4 questions.
Cap and trade, tell us.
Cap and trade, absolutely opposed. I spoke before the coal-producing counties recently and debated Mongiardo and Conway on this. And here's an interesting thing about Conway, because some fear him because he's raised so much money. He's the worst of the Weasley career politicians. He got up and he said, well, I'm kind of a little bit for it, but I'm kind of a little bit against it. And then he said, it was even worse, it got worse. And this is before the coal-producing counties, which Republican or Democrat, they all know it's a bad deal. And then he said, well, I want to be part of the negotiated compromise. I don't want to lay my cards out on the table yet. And he about got booed out of the place. Mongiardo was much better. So we have to really hope that Conway kicks his butt in the primary, because Conway will be much easier to beat, actually, than Mongiardo.
There's another question here.
About healthcare.
I've talked a lot about healthcare recently, and in fact I've been on Glenn Beck's show a couple of times talking about this. I'm a physician, and it's an issue that we, I think, can present a lot of issues that will help people on healthcare. With healthcare, there are 2 problems. There's access and there's expense. And they work in opposite directions. All they talk about is access. So they'll tell you 46 million people don't have insurance. But you have to define who are the 46 million. A third of them make more than $50,000 a year. A third of them are eligible for Medicaid, but don't bother to sign up because they can just go to the ER. It's easier for them just to walk into the ER than go down and fill some paperwork out. 20% of them are in our country illegally. About a third of them are without insurance for less than a year. So I'm not going to say access is not a problem. I will say emergency access is not a problem. Everybody in our country, 100% of people have emergency access to health care. There are some other problems with access, but I think the other problems with access have to do with expense. And you can't have what Obama says, access for 46 million people and won't cost anything. That's a pipe dream and nobody believes it, and the longer we talk about it around the country, the better chance we have of defeating that. But on the other side of the coin, we have expense. And I always tell people, if the stress of your question gives me a heart attack today, and next year I have to buy my health insurance, I have a 1-year plan. I have a $5,000 deductible, but they still will double or triple my rates because now I have a condition. So the problem is we have 1-year contracts. But contrast that with my term life insurance. I have a 20-year term life insurance plan. I'm about 10 years into it, and if I have a heart attack and I survive, my rate's still the same next year. because I purchased a 20-year contract and it's based on my age. But the only way you get to term life insurance, the answer is ultimately we need health insurance to be more like term life insurance. To do it though, there is some convincing of the public because it is counterintuitive to many people, but you have to have a higher deductible and you will have to pay for your procedure, your office visits through cash. And it works. There are two things in my practice where costs have gone down every year for 15 years. Contact lenses, you can get a contact lens, one from me for $4.30. Go to Walmart, they're $4.25. I'm within pennies because I have to. Because people pay cash and they won't come to me. They'll just say, give me your prescription, and they'll go to Walmart. So I have to compete. Because the price fluctuates and cash is paid, it works. It also works in some more expensive procedures. I do LASIK to get rid of people's glasses surgery, and it's several $1,000s, but it's gone down every year for 10 years as well because people are not covered by insurance. So really, it's counterintuitive, but you really want less insurance and more payment. What we have in medicine right now is we have private ownership and profit, but we have no mobility of prices. Capitalism has to have mobility of prices. So we have to ask the first question whenever this comes up is, are our problems because we have too much government now or too little government? I would argue that most of the problems we have in healthcare are already created by the government. 55% of my patients' payments are from the government already. And Medicare is chronically short of money already. So how are we going to make it better by adding more people onto the government system? It doesn't work. And the demographics are against us on Social Security and Medicare because it used to be 7 workers for 1 retiree. And it's getting close to 1 to 1. It doesn't work. None of the programs are working, even with what we have. But that's also why it was a huge mistake for Republicans. And we've got congressmen in Kentucky who brag on the stump about how they got Medicare prescription drug plan. Enormously expensive and nothing's free. And is there a reason why when you're over 65 you get something for free and a guy for 20 has to work for it? The richest quintile of the public is over 65. That doesn't mean there's not problems. There are exceptions. There are people who are very sick and have $4,000 bills in medicine, but the average senior citizen actually still pays more for food than they do for drugs. But we have to think these things through before we do, because now we've got that locked in and that's bankrupting Medicare even faster.
One more? Sir?
Where do you stand on abortion at one end of the continuum and euthanasia on the other?
I'm opposed to both. I believe that life begins at conception, and I think Roe v. Wade should be overturned. In fact, I would go one step further than what we've tried. We've tried for a generation to get enough on the Supreme Court to change things, and we haven't. I think we should make Roe v. Wade part of our philosophy as far as states' rights, in believing that the state should have the prerogative over this. Some believe, and there probably will be a constitutional battle over this, but there is legislation in the House that says, and the Constitution says this, that Congress has the authority to decide the jurisdiction of federal courts, federal appellate courts, that we could actually change the jurisdiction and say it's not a federal issue. Many people believe that it was wrongly ever in federal court, that it never should have been in federal court. The disadvantage to this approach is you have a hodgepodge of state rules. The advantage is you'd immediately have some states like Kentucky where you probably would have no more abortion.
Euthanasia.
Oh, euthanasia, opposed to it also. One quick thing on euthanasia, and this goes back to the healthcare thing. The state of Oregon sends out notices to patients saying, "Dear Mr. Smith, we're sorry that we have to deny your chemotherapy, but as a consolation, you are eligible for assisted suicide." This is from the state government, the state plan. So when Glenn Beck gets up there and talks about death panels, all the other sides say, "Oh, he's just crazy and he's loony." There's a little bit of truth to that idea of death panels, because it's already coming in a state-run health plan saying that you don't get your chemotherapy, but by the way, it's cheaper if we just pull the plug. Thank you very much for having me. And I have to run to another event, but it's not because I want to be rude to Trey or Bill. I've heard them before, and I think they have some good things to say.
Thank you.